The global shortage of safe abortion training has had an implication on women's health in that women are more likely to die from complications.
It will lead to a high mobility and mortality rates for our women in the country and even on a global setup.
The women are exposed to unsafe abortion practices.
It is that it puts them in a lot of risk in trying to access abortion.
Incapacitates the healthcare workers, which in one way or another leads to human rights injustice, because all women, rather all human beings, are entitled to quality healthcare. So if these women cannot access quality, safe abortion, it means we are infringing into their human rights.
It increases the prevalence of complications emanating from poorly managed abortion services.
The implications are death, infertility, or certain difficult other health medical conditions.
Calling all healthcare providers. Are you looking to increase your knowledge of medical abortion and better support women seeking safe options? Then, PinkShoes.org free and certified medical abortion training courses are for you. To access the courses, visit PinkShoes.org and select Course Certificate from the drop-down eLearning menu. Next, create a user ID and choose the course you would like to take. Registration is free and open to all with subtitle translations available in multiple languages, including Swahili. Isn't that amazing? Each course should take approximately 1 hour to complete, and after each lesson, students will be prompted with a short quiz. Students who complete each lesson with 80% or higher will be able to download a free certificate of completion. It's that easy.
The training on safe abortion has not been included in this curriculum because apparently the universities still believe that abortion is not allowed in Kenya.
In places or countries where the provision of safe abortion care is restricted, either because of the prevalent religion or because of the law of the country.
Bearing in mind that most of these institutions, they are people who are born again, they are people who don't believe in such things.
Because the constitution is not clear on the issues of abortion.
It's still a sensitive topic.
Many providers shy away from providing the service.
In Kenya, there's no clear guideline from the constitution or even from the policymakers in matters of safe abortion.
In Kenya, when I was training, the law was prohibitive of abortion. The law has since changed after the promulgation of the constitution, but at the time, it was against the law to provide safe abortion services. Therefore, even in college, we were not taught how to provide safe abortion services. There was no formal training on it.
I received post-abortion care training when I was in school.
There was no much of safe abortion.
We basically received training on post-abortion care.
I took PinkShoes online training courses because it has a lot of information on medical abortion training.
The online course on medical abortion was very key in upgrading my knowledge.
Because it helped to know the eligibility criteria of the women who are supposed to do the abortions, how to manage the side effects like the cramping and the bleeding.
So I opted to take the course because of information.
I took the pharmacist course, and what stood out for me was how the course was being presented. They had really nice videos that was so simple to understand.
My experience was while taking the course was a good one. I took the course for medical students.
On my part, I found the course very interesting. It was very detailed and relaxed. I found it easy to grasp information. The course that I undertook was the pharmacy course.
I took the medical students course. It was such an interesting experience for me because it's like they incorporated all type of learners. If you like videos, the videos are there. If you like the audio aspects or the text, everything was well catered for.
Parts of the course that were most valuable to me were the information on how to administer the different abortion pills. I found that to be very interesting since I had never, we've never had that training in our education system.
The drugs, their use, how to administer them, and how to check for any adverse drug reactions.
Pre-abortion care, as I said, this is now where the start of the process goes on. And this is where it determines whether the abortion is going to be successful or not. So the pre-abortion course is very important as it prevents a lot of complication that can be able to be got from using the drugs.
Basically, it's the proper management of clients, which includes the proper administration of drugs, all the way including the full package that includes the family planning, all what is supposed to be provided, and abortion care.
It's important for healthcare workers to receive this training because it will really equip them with the necessary information and skills.
It is an essential part of reproductive healthcare, and therefore it should be provided for in the training curriculums of all the healthcare providers who are licensed to provide healthcare.
These women will come to us, and so we cannot ignore that. So the fact that we've not been going, that it has not been the curriculum, tells us that we might fail somewhere, because these girls and these women will come looking for us. So it's important for us for it to be put in the curriculum, and it's gonna reduce the mortality rate, because when you do it in the curriculum, you go out to the field to practice, knowing this is how you're supposed to handle these girls and all these women.
If all pharmacists and medical care professionals received safe abortion training, I believe it would have a huge impact on maternal mortality rates, of course a decrease, and would reduce the number of complications arising from unsafe medical abortion procedures.
It would start from the basics, from why this service is needed in the first place, what are the indications, what are the clinical indications, what are the non-clinical indications, so that when women require the service for any of those two, because it's not always that the indication is clinical, once all providers are aware of all the situations where abortion care should be provided, then women would benefit from the service more broadly than is currently available.
Women's health will improve in that they're going to seek the service and be able to get the right service at that time.
The other workers, they need to have the information. They need to be trained on this issue of abortion pills, because they also receive clients who need such services.
Safe abortion is a life-saving practice. We understand that unsafe abortions in Kenya contribute to about 35% of the maternal mortality. So if we are able to educate all healthcare workers, not just the medical doctors or the pharmacists or just the nurses, even the community health volunteers who are actually at the grassroots, if we are able to equip them with this knowledge, then we are going to prevent a good number of the premature deaths we are seeing.
Well, what I can say is that, of course, termination of pregnancy has always been done for medical reasons and for emergencies. And of course, according to the law, there are 4 indications where the pregnancy can be terminated within the law. So if there's an indication of a termination of pregnancy, even if it's because of one indication, the healthcare provider should be able to they should be taught so that they know in case there's a case of termination. For example, if someone comes with intrauterine fetal death and they have to terminate that pregnancy, they need to know how that pregnancy can be safely terminated because it must be terminated for the woman to survive.
It is important that all healthcare workers receive training on safe abortion to be able to give quality care and also prevent severe complications that come around unsafe abortion practices.
I would like to call on my fellow medical students to take the online course provided by PinkShoes on their website, pinkshoes.org.
So the PinkShoes website provides training for safe abortion care, and it provides the training for medical students and pharmacy students, and it is also open to nurses, to students of nursing and midwifery, as well as clinical officer students. And the course is free, you do not pay for it, and it is freely available on the website. And at the end of the course, once you have completed it satisfactorily, you get a certificate that you can download and print or keep the soft copy of.
To note, the online course is free and you're going to get a certificate which you can upload even for CPD. Yes, please go to PinkShoes.org and do the course.
I would encourage other pharmacists as myself to do the course, because there have been so many stories of women having illegal abortions, things that risk their lives just because the pharmacist or the pharmacy worker was not well trained to give these abortion services. So it would be really nice to have the course done by all pharmacists and pharmacy workers to be able to help our patients in seeking these services.